we're supposed to be looking at should that person be transferred, those type of things. So we try to keep people less than 72 hours to keep our critical access hospital designation. So, and we currently don't have anyone with COVID-19 in our hospital, but for the last month or so, we've had plenty, some county residents, some non-county residents. So our percent positive rate currently is 11%, which is really good. We were up almost to 30% for a while. Our incident rate going back January 6th to the 19th, if you remember, we go back 2 weeks to make sure that we have all the data, 347.9. But if you look at the data from, and I have data from January 28th, which doesn't include all of our data that we'll collect, but this is a really nice graph going downward. So that goes from January 8th, which we were at 573, down to 223 on January 28th. So we're definitely heading the right direction. We're having somewhere around 5 positive cases daily in the county. That includes central cases. At Christmas time, we were seeing 25 to 30 cases daily. Central's doing their own case and contact investigation currently. We are working with them. They are doing prevalence testing on campus, and they've had a lot less disease this quarter than they had in the fall. Having a little bit more that's occurring in the student athletes, and we'll talk about student athletics in just a minute, but it's really what we're seeing still is people getting together in small groups, both with on-campus and off-campus folks. You know, we take our masks off, we sit in the house together, we watch the Super Bowl. I'm asking everyone to watch the Super Bowl at home with your immediate family, because we'll have a bump for sure. I mean, that's another big holiday. It's too bad if Disneyland was open and you wanted to go on the least busy day of the year, you should go to Disneyland on Super Bowl Sunday. It is amazing how it's like half of the normal people at Disneyland. So, so we're going to have a problem after Super Bowl. So this, all of our data said we are currently tied to the South Central region in regards to moving forward. This has less effects on schools, but it has a lot of effects on businesses and people being able to work and those type of things. So we are tied to the South Central region, which includes our neighbor to the south, Yakima, which is the big problem, and I'll explain why. But Yakima, Benton, Franklin, Walla Walla, and Columbia County. We've been working closely with them, but we are now a very small fish in a big pond. We have less control over those counties than we have control over our own people in our community. So Yakima is the big problem child because they lost one of their hospitals. So they have half the hospital capacity than they had just prior to the start of the pandemic. So they have low hospital capacity. And there's been a lot of historical issues with equity and social justice and with racism that's occurred in Yakima. And so there's a lot more fighting amongst people in Yakima than there is here about who should get vaccines and who should be first in line and who should we be prioritizing. So as we look at moving from phase 1, which is where we are, we had some changes that were made that allow us to move into phase 2 if we meet only 3 of the criteria instead of all 4 of the criteria. I think we'll be moving into phase 2 with the data, not this coming Friday, but next Friday. And then that data is re-looked at every 2 weeks. So it allows us to kind of move forward, but we can move back to, and with the influx of the agricultural community, we're going to have a lot more disease. So yes, Tokyo Disneyland is open. Our California Disneyland, I'm not sure when that's going to be open, but as you all know, since I touched base on sports in the college setting, phase 1 allows some sports, and phase 2 allows some sports to be happening, sports competitions. I talked to Jeff Hashimoto. The first cross-country meet is not this coming Saturday, but the following Saturday in at Franklin Park in Yakima, unless it ends up getting canceled. There's a lot of generalized angst over making high school athletes wear masks when they're exerting in sports. And so there's definitely a different way that people are looking at that problem with college athletes. So if you look at pictures from the Washington Indoor Track and Field Championship meet that happened last weekend, there's a lot of athletes running really hard, including a freshman that ran a sub 4-minute mile, not wearing a mask. So I'm working with Bob Lutz, who's the governor's liaison in regards to things for youth sports, to try to work on those pieces. But anytime we add something, it creates more risk, right? So when we were all at home in March of last year doing nothing, there was less risk than there is now. And as we move forward, there'll continue to be more risk. Now, we're mitigating some of that risk. I saw Sam just put her mask on with mask wearing, still continuing with social distancing, washing our hands, those type of things. We've not had much disease in the schools since school restarted again, either in teachers, staff, or in students. So that's been a good thing. Candy continues to work closely with the school districts in regards to doing case and contact investigation. We're actually doing more case and contact investigation in other cases now that the numbers have gone down. So it's allowed us to do a little more work. But K through 12 exposures and nursing home outbreaks have taken priority here at the health department, and they've never gone away. So so we're doing well. I'm worried about a bump after 2 weeks after the Super Bowl. So that's where we're at from a disease standpoint. From a vaccine standpoint, we do not have enough vaccine. That's the problem, right? So that's ultimately the problem. It's a manufacturing problem. It's a fact that a lot of the manufacturers were placing bets on whether or not they could get a vaccine that worked, but they weren't willing to build a big giant factory to produce as much as they needed. So we have 2 vaccines that are very effective, the Pfizer and Moderna vaccine, and probably Johnson & Johnson will be out soon. The Johnson & Johnson vaccine has the advantage of being a 1-shot instead of a 2-shot vaccine, and it doesn't have the cold storage requirements. People are a little concerned that, and I've not seen the final data, but it has about an 87% efficacy on my review of the data on preventing hospitalizations and deaths. So not quite as good as the Pfizer or Moderna, but better than what we would have expected. It has not been approved yet. So we're still with just 2 vaccines. Other vaccines that have been approved in other countries have not been approved here yet. So going back to vaccine in Kittitas County, Let me take another step. So Superintendent Reichdahl kind of stirred the pot a little bit with with um, that is not a cabinet level position in the governor's office. And because it's not a cabinet level position, they work like over here, and the governor's office is working over here. And so the governor's office was not informed until the press release came out that the school districts had come up with an agreement with Kaiser to vaccinate school teachers. So it's great that that's in place, but there still is no vaccine. So we have no vaccine to do that. Ginger had sent me something, maybe it was this morning, maybe it was yesterday, about Safeway being willing to give vaccine to schools. There's still no vaccine. I mean, the problem is that we last week we gave 1,093 vaccinations in Cle Elum and 1,073 vaccines in Ellensburg. We only have 975 Pfizer vaccines for this week to do in Ellensburg, and we have 200, plus we've scraped together about another 60 to do a one-day clinic in Cle Elum. That's all the vaccine that we have currently in the county. Safeway probably has a few doses. They had 200 doses to start with. I don't know where they're down to, but we don't know. We know we're not getting any more vaccine this week. We don't know whether we're getting any vaccine next week. So the primary problem is not, are people willing to help get people vaccinated? It's that there's no vaccine. We are currently in phase B1. So phase B1 are people older than 65 and people that live in multi-generational households. So a 52-year-old who is taking care of their 79-year-old mother, but they also have a 13-year-old child in the household. They qualify. And once we get over 50% of people in phase B1 vaccinated, we have the ability to be flexible in the B2, B3, B4 range. So we cannot move into those until we've vaccinated enough of B1, but we have flexibility in B2 through B4. And if you remember, B2 are youngish school teachers that are older than 50, and B4 are older school teachers that are or younger school teachers that are under 50. So it's that the cutoff is there. And there's this category of B3, which are people older than 16 that have multiple medical problems. What we are planning on doing in our county, and there's a whole group of people working on vaccine equity and who should get vaccinated, but we will end up combining the B2 and the B4, and we'll be coming to the school districts to vaccinate teachers using school district nurses and modification of the plans that we've done here locally. So that's what will happen when we move into out of the B1 and into the B2 through B4. I can't tell you when that's going to be. It's all dependent upon how much vaccine we get. And but we're working. I see Kate's on. I'm working with the school leads, the Cle Elum Roslyn nurse, the nurse from Kittitas, our nurses here, and the nurse from Thorpe Easton, to develop those abilities to give vaccine in schools. We can still use Safeway. I mean, when they have the ability to do that, we can still use Kaiser when they have the ability to do that. The issue really is I'm like a broken record here. It's we don't have enough vaccine, and um, who's going to get, which counties slash areas are going to get the vaccine first. There was a lot of angst in regards to um, the governor saying we're going to start these big vaccine clinics in places. We have two in central Washington, one in Wenatchee, and one in Benton Franklin. And what all of us in the small counties said is, you can't really take the vaccine that's allocated for our county and give it to somewhere else, because that doesn't benefit our community. So we've pushed back pretty hard. We've been fortunate that Rich Elliott and his group that did all this vaccine distribution work made the national news, and that went to the governor's office, and the governor's office knows we're doing good work. I spoke with Congresswoman Schreier on Monday, and she mentioned Kittitas County on the House floor yesterday. Unfortunately, she didn't. I talked to Dr. Larson. She said she didn't really say Rich Elliott and his team did all this work, but that's who did all the work. But we've gotten national press about what a good job we're doing. So I don't think we're going to have people are not going to take away our vaccine allotment. But that's if you only have 1,000 doses. Currently it's being distributed by population. In this case, population over B1. So population over 65% of the population that we have in Kittitas County of those people in comparison to what King County would have. So King County would get X number of doses, we would get Y number of doses. If there's a group like Kaiser who says, well, we want to start this big push to vaccinate school teachers, if there's only 1,000 doses total, where are those doses going to come from? So that's the push and pull that are happening at the state level. It'll be relieved when there's more vaccine available, but that's kind of where we're at currently. And so we are getting consistently 6 doses out of a 5-dose vial of Pfizer, and we are getting 11 doses out of a 10-dose vial of Moderna. We have to use low volume dead space needles to be able to do that, because you have to get the last few drops out of a container. Those companies have figured out that they're going to charge the federal government for those extra doses. So we are currently getting extra doses, but we as taxpayers are going to be paying for those eventually. So, but we're getting extra, which is why I said we gave 1,073 in Ellensburg that last week. That was 1,073 doses out of a pizza box that should have had 975 doses. So, funny in regards to supply chain, what's short currently is low dead space needles. So because we're all trying to get the vaccine out of the vials. Moderna is talking about increasing the volume in their vials to 15 from 10 to increase, because it sounds like perhaps one of their issues is not having enough vials, not having the vaccine. So we're working on that. The only other thing I wanted to update people on is that we do have the B117 variant in Washington State. We had 3 cases that were identified. There's definitely more. The governor has made it a priority to be the lead in the evaluation of variant disease in Washington State. So he wants us to do a better job here than any other state is doing. So you can expect that we're going to see more variant disease. It is more contagious for sure. And there may be some changes that come down the pike as that becomes more of an issue as far as masking requirements go, but that has not changed yet. But if you read the popular press, there's a lot of talk about, should we be wearing a surgical mask with a cloth mask on top? What should we be wearing? And that has not changed yet, but I would expect relatively soon that we'll have some CDC guidance on that. Questions that have come in so far. Joan asked about CW interns, student teachers. For them to graduate, we have to have the ability to have them work. I know Central has talked about doing more testing in those students. They're higher risk just because of their higher risk of having disease, because they're not staying at home watching TV by themselves, right? So I had been working with Central in regards to that, and I will reach out to James, who's their project manager, to see where we're at. Let's play football. I have being a sports parent, I have really mixed feelings about sports happening. The governor has allowed sports to happen, so we're stuck with that. I spoke with the athletic directors a couple of days ago. My biggest concern is not what's happening here, but what's happening in, for example, if SELA sends their football team up to Ellensburg to play, but that's currently allowed in phase 2. So Dan asked if we have our first vaccination, do we automatically have a date for the second? We are not saving vaccine here in Ellensburg. So we have, after this week, we will have 0 doses, but the state has automatically plugged in. The doses we're getting are, for example, today we are giving follow-up second vaccines at Pacifica, which are Moderna vaccines, which were 28 days after the first. So yes, you will be contacted. If you had Pfizer, it'd be 3 weeks after your first, and if you had Moderna, it'd be 4 weeks. We are not in Washington State saying we're gonna not give people their second dose. There's a lot of countries that are starting to look at that to see if we can get, essentially, the more people we can get vaccinated, the less likely the virus has hosts to infect, and the less likely that it's gonna become a variant. So so Amy asked about B2. I can certainly ask for the data on that. I can give you data from the clinics from last week, and just from a percentage standpoint, we gave 310 doses of Pfizer in people between 65 and 69, 300 doses of Moderna. The majority of it went to people older than 65. We had a few folks that fell into the less than that, and I don't know how they fit into if they fit into the other B1 category, but we can get that data. What we're trying to do, so there was a mess with the sign up. We're using Sign Up Genius, and because that group that was working on that is working so hard to try to get all those pieces done, there's obviously going to be some errors that get made. So there were certainly errors that got made in regards to the wait list. We went from 300 people on the wait list on Friday morning to 122,000 people on the wait list by Friday afternoon. Some of that was the CNN article. Some of that was the article that was in the Yakima paper. And at least some of it was people had to put in their date of birth and or their age and an email address. That was what was in the field at first. That's been changed now. But one person put their zip code for Bellevue in as their age. And so that obviously increased the numbers of, it just threw the whole system off. So they're scrubbing that system again. That should raise the question of whether or not we should be vaccinating people outside the county. Legally, we cannot keep somebody from outside the county from coming in to get vaccinated because it's a government product. It's a U.S. government product. It's not a Kittitas County product. But we are prioritizing the wait list based upon county. So if the first 10 people are from Bellevue and the next 10 people are from Thorpe, those next 10 people would probably be moved up on the list. So they're trying to figure out by adding some fields how to do that to make it equitable. I don't know how many of the B2 have been vaccinated, but we have 9.4% of people in our county that are currently vaccinated with at least one dose. So 9.4%. Joan asked if the students are higher risk than the substitutes. Well, if the substitute is a 20-year-old male that lives with 3 other male students on campus, then that person is the same risk as the students. It really has to do with human behavior, which is hard in the group of college age. I mean, that's really where we end up with the problem. Nick asked about the variants. The 3 variants that we have in Washington State are currently B117 variants. And one of the ways that they find those is that there's an S dropout that ends up calling some people negative. So now what we're taking from all the labs is those negative tests that have dropped out because they have this part of their mechanism is a S protein, I believe, and so then they're testing all of the samples that have a S dropout. That includes the South African variant, but we've not seen that yet. Is there a window of time when the second dose can be administered? Right now, we do not know. That the vaccines were tested with 21 days for the Pfizer and 28 days for the Moderna. So we're trying to keep people as close as possible. If somebody's out of town, we would just vaccinate them when they come back in with their second shot. Here's something that's being looked at, which is very controversial, but it's about equity. Is that, and you'll probably hear some about this. We're really concerned, at least certainly in Central Washington, about agricultural workers, and so there's a lot of talk, especially if we get Johnson & Johnson vaccine, that agricultural workers will be vaccinated with Johnson & Johnson vaccine, because then we don't have to worry about a second dose. So you vaccinate those. I mean, the best thing would be you vaccinate them way early in California before they start moving north. But let's just say we don't have any control over that, which we don't. So we make sure that people are vaccinated when they come into Washington on the Oregon-Washington border. And then we don't have to worry as those workers move north into Benton Franklin and Yakima and Kittitas and Grant County and Okanagan that they're putting people at risk. So there's certainly some controversy in regards to that. I kind of touched base about that with Yakima is, with limited supply, who should be getting it, and hopefully we won't have limited supply forever. So Angela asked a really good question about phases and out-of-state travel. So it's not really. So I'm going to go back to where I probably started, which is I like our governor, but our governor is micromanaging this whole process. And when we micromanage things, and I'm a micromanager too, and I've had to learn to let a lot of things go. And maybe this person's not doing as good as this, or the same way that I would do it, but I have to, you can't do all of the things. So the governor is looking at the fire that's burning in front of him, but he's not looking at all these fires that are out here, which include things like the travel ban and those type of things. So the current guidelines from the governor's office is still the same. If we go out of state, we have to have a 14-day quarantine period coming back into state. If we, and that's guidance, that's not a law. If we are in South Africa and we come back to Washington state, we have to be in quarantine for 14 days. That is a law. So there's a little bit different between that, but we do not want to have South African variant or Brazilian variant. So if you decide to go to England or South Africa, well, I was talking to some folks at the college that have some people coming from Africa. I said, don't have them fly out of South Africa, have them fly out of somewhere else, because if they're flying out of South Africa, they have to be 14 days quarantine. Other questions today? So I do want to say that most of the work that's been done has not been done by me. That gets back to you can't micromanage this. It's been done, the vaccine work has been done by Rich Elliott, the IMT, the hospital. We're going to need volunteers. I mean, if you just look at the numbers of people that we need to get vaccinated to get to 70% herd immunity, it's a huge numbers. And our plan is to continue to do vaccination clinics, both in the Upper County and in the Lower Valley through the summer. So if you want to feel good about your life, you should sign up to volunteer, because what you're going to see is there's all these people that are so happy, and the fear has gone away, and people are crying, and it's just a really wonderful thing in a very dark time to say, well, look what good is happening, and look at these people that are really thankful for what they got. And so there's currently they have plenty of volunteers, but as I said, volunteers, they run out of gas. And there's a way to volunteer through the hospital. So please think about that. So again, Angela brought up so we don't have to quarantine out of state travel. My recommendation, just like my recommendation to not watch the Super Bowl with others, is don't go out of state to travel. Just don't do it. So because you're then mixing families. You're not going out of state to travel to sit in a hotel by yourself. Otherwise, we'd just stay here. So it's not a requirement. There's no law that says that. It's the governor saying you shouldn't travel, and so it's not a suggestion, and there is science behind it. There is no there's no law enforcement officer for most of this, actually, and that's been one of my I mean, I wish that I could have law enforcement go to places that I know are not doing things that are helping us move forward. Um, but I don't have any backing for that. And so what I told Clay is I said, I'm just not going to stop at any stop signs anymore, because if you can choose which laws you want to enforce, then I'm just going to choose which one I'm going to pay attention to too. So I've not had a wreck and I've not gotten a ticket yet, but that's probably yet to come. So it's the same thing with the out-of-state travel. Each individual organization has to make a decision based upon a business decision. But my recommendation as a county health officer is we shouldn't be going out of state to travel, because we're bringing disease back. I know people travel. It's just a bad time to be doing that. Susan asks the crystal ball question, which I get asked all the time. Do you have any idea when 1B Tier 2 will begin here? So I think within the next couple of weeks, if we get more vaccine next week. So a lot of it, I mean, I wish we had more vaccine now, but if you just, and next week I can give you the number, or maybe I'll get the numbers to Ginger and she can send these out. I can get a percentage of the people in 1B that we have in the county. And it's a rough number because not everybody, I mean, that's a number based upon things like how many patients do I personally have that are older than 65? You know, we can get that out of a database, out of a medical database. We can get some of that out of the national numbers and those kind of things. So we can have a pretty good idea of what the percentage is, and then I can tell you what percentage of those people that we've actually vaccinated. And then it really is dependent upon getting more vaccine. But I am hopeful that within the next 2 weeks or so, I'm hopeful that we would be into out of 1B Tier 1 in February. But it's all really dependent upon vaccine availability. It's not, if we have more vaccine, then we'll be out of that. If we don't have vaccine, we'll be still in there. I mean, the real piece that's helpful for us, and it occurs on a county by county basis, because it's really, I have to, as the health officer, have to approve any modification to the phases. So we may be in phase 1, be out of phase 1B, and we're saying, okay, we're gonna pile our B4s, which are the younger teachers, with the B2s, and we're going to start vaccinating them right away. That may not happen in Issaquah. They may not do that. So there's going to be, then people are going to say, well, why are they doing that in Kittitas County and we're not able to do that here? And it's because they don't live in Kittitas County. That's why. So I'm hopeful soon. It's just really dependent upon vaccine availability. I've started talking to a lot of people about things like high school graduation, more activities at school, again, what's happening with sports, and this goes back to the travel thing. Each one of those things that we do increases risk. So most of that is the decisions are made at the governor's office, and I can only be more strict than the governor. I can't be less strict than the governor.
All right. Well, I think that I don't see any more questions there. So thank you, Dr. Larson. We just appreciate you so much. Yep. And just look forward to connecting to you every opportunity that we have.
Yeah, and I'll get that data to you, Ginger.
Oh, that'd be awesome.
And then you can get that out to people.
Yep.
All right, y'all take care. All right, bye.